Welcome back to West Texas View.
Welcome back. When they came into the office, one of the first things I noticed was this beautiful poster they brought with them. And I said, what is the OEF, OIF program? And so now you're going to explain that to us.
I'll be glad to. The Operation Enduring Freedom, Operation Iraqi Freedom Program is for all of our veterans that have been discharged from the military that are coming back from either Iraq or Afghanistan. Most of those folks have been involved in some kind of combat situation. We have a program set up just for those veterans, male and female, and we have a program coordinator. Her name is on that poster. Her name is Jill Johansson. She has a team of veterans that work with her that have, in fact, many of them are OEF, OIF veterans, so they know exactly what they're talking about. They've been there, they've done it, they have that experience. They're very valuable assets to our healthcare system. They can help these veterans get enrolled in the system. Keep in mind there are limitations for this particular group of veterans on when they can apply for care from the VA. You have 5 years after the date of your discharge to come in and get enrolled with our system, and you'll get 5 years of care, no questions asked. You also get some dental care for the first 3 years, which is very critical. And the veterans need to come in and talk with Jill or her team, and they can get them enrolled and get them started. We're very also interested in talking with our female veterans that fit this category. They are the youngest veterans that we serve. Many of those ladies, of course, have families, so we're trying to work our schedules and work our facilities where they can come in and have as little disruption as possible. And these folks are really interested in facilitating that. We also can see them in our community-based outpatient clinics. So it's a very important program. If you're an OEF or OIF veteran, I would encourage you to make contact with us so that we can explain the programs, what they're entitled to, and get them registered.
Or if you're a family member
yes, even
of Iraqi and Afghanistan, this is really important that you pave the way for a son or daughter that's going to be coming home soon, because you need to get involved in this right away. It's easy to forget for some reason, because we have people that live in Big Spring that said, you know, I'm a veteran and I never thought about going to the VA hospital, and I'll say, why not? Well, I don't know, I just forgot it. I just always forget about it.
Every time we go to a health fair or some kind of function, it's always interesting to hear a veteran say, well, I didn't even know that you all had a facility in X. And we hear that all the time. And so we encourage them. In fact, we have people that come to these health fairs, and they can sit there and register that veteran and get them signed up in the system. And we process their applications, and if they satisfy all the requirements, we'll get them enrolled in our system. Not only for the pharmaceutical support that they need, but also to get them enrolled with a primary care physician, so we can get them a full range of services to ensure that they have the highest quality of life possible.
Well, this may be a strange question, but what are the requirements? I thought a requirement was just that you were a veteran.
Well, it's not that simple anymore.
Okay.
There are income limitations that have been imposed by law through Congress.
Okay.
But our folks can walk you through all those. They have to take care of an application. We also have a computer application for those that have internet access called My Healthy Vet. You can actually go in on that application and register online to get seen by the VA and receive your health care. And we have a number of veterans that have done that. We also have My Healthy Vet terminals at all of our locations. If you want to sit there and do that, if you don't have internet access at home, you can come into the facility and do that online, and we have people that can help you fill out that application electronically. If you want to use paper, we still have paper. Either way, we'd like for them to get registered so that we can take care of them.
Well, tell me about your funding, because I know that you're part of the VA system overall, and I know that the legislature appropriates a certain amount to the VA system, but you have other means of income. You earn a certain amount of income.
Well, our current appropriation level for this fiscal year is around $100 million. Congress has been very generous with the VA in the last few years. Our secretary has been very aggressive in presenting all these new programs that he wants to implement, including eliminating homelessness within 5 years. So that's an important goal. We receive a number of contributions through our voluntary service program, and our service organizations are always a wealth of financial support. I was just over in Odessa a few months ago, and we got a $5,000 check to help us buy a new van for our veterans. So that kind of support, you just cannot underestimate how much support there is for our veterans throughout the whole West Texas community.
Now, the patriotism, I think, in West Texas it really makes us appreciate our veterans more than it does in some parts of the country. But another thing that you touched on just briefly is that you have you get the funds from the legislature to run your hospital, but in addition, you're given funds for new construction projects.
Yes.
So this building of this new domiciliary does not come from this $100 million that you're taking care of patients with.
That is in our construction budget, and that project alone is like $6.5 million. That's part of the $26 million that I was mentioning a few minutes ago. All of these things play importantly into our future as we try to work on new things. We are in the process of implementing what we call veteran-centered care, where we really put the veteran at the center of everything that we do, and we also bring in their family members who can, in many cases, help us fill in the blanks where the veteran either can't remember something. They can help us with medical history. They can help us with what kinds of problems is the veteran having. We're also putting in a proposal for a new community living center that's going to be what we call like a greenhouse concept, and the veterans will live in these little cottages.
Yes,
and it'll be in a more home-like atmosphere. And our network director has been very supportive of that so far, and we have to do a formal presentation on that in a few weeks to our folks that score our capital asset project. So we're very excited about that. Our folks in West Texas have done a great job of getting prepared for that. We've talked with other VAs that have been successful. We think we have a great proposal, and it certainly will help us improve the care to our veterans in the geriatric sense, but also give us the opportunity to expand our geriatric care for our veterans that are in their senior years.
It has been such a pleasure to visit about our VA health systems, and I want to remind you that in just a few weeks or a few months, we're going to be celebrating 60 years of the VA hospital in Big Spring. And I certainly want you to take down the number that's scrolling across your screen so you can call and ask additional questions. But the important thing is all the veterans need to get signed up and get into the health care system so that when you have a need, you can go in and you're already ready to go. Parents or wives or husbands certainly can call with any questions or can help sign up someone that is now in Afghanistan or Iraq. And so again, thank you, Laurie, and thank you, Daniel, for coming today. We'll see you next Sunday with another program, and thanks for joining us today.
Thanks for joining us for News West 9's West Texas View with Johnny Lou Avery. This has been a public affairs presentation of KWAB-TV and KWES-TV.